Hi, my name is Sarah. I'm a professional dog trainer, and in this video, I'm going to show you how to teach a service dog alert. This is probably one of the most common things that we teach here, and it's actually super easy. Um, the first thing that you need to figure out is what you want your alert to look like. Um, so here we're going to see this service dog go right into deep pressure therapy. That's what he's trained to do for his alert. So he sees that and he goes right into that. So that would be the first thing that I would want to narrow down, is what you want that alert to look like. We can go right into deep pressure therapy. We can do a nose touch, which is another popular one. Also a paw touch is also a popular one. And barking, although I've never taught that. You could teach the dog to bark to alert. It's whatever you think is going to get your attention the fastest, that's going to work best for your lifestyle, right? The second step would be putting that same command, instead of on a verbal cue, we would transfer that into some kind of physical sign that the dog could see. So here I'm kind of scratching all over, which was what this particular dog needed to alert to. So this would depend on your disability, right? Some people have very obvious physical cues that they need the dog to alert to, and some people don't. Sometimes we're teaching the dog to alert to a smell, or that would be like a diabetic alert dog, that would be a smell. Um, Often the dog is also listening to the heart rate and picking up different things that way. So whether that's an anxiety attack, or there's many other ailments, that the heart rate will be an indicator for the dog. So they're the only one actually hearing it. You might feel the change, but the dog is actually going to alert to the sound that your heartbeat makes when it changes, right? Um, but there needs to be some kind of physical cue for the dog to pick up first. So we have the verbal cue, then we need some kind of physical cue. So here it's just me kind of tapping my fingers together. That's what he's learned to kind of alert me to. So if you do have a disability that involves heart rate, or something that the dog kind of can't um, see, you're not kind of obviously moving your leg like I am here. It's something that you can't physically see, that the dog can't physically see, and it's something they need to pick up on. You still need to have a physical cue for the dog that you're going to do when you notice it. So for example, if it's a heart rate thing, you need to wear some kind of monitor, and then when the heart rate starts to go in a direction where you want the dog to alert, then you need to prompt the dog to alert with some kind of physical cue, right? Because you want the dog to be watching you, right? It can't be a verbal one where you're kind of calling out to the dog. It has to be something physical that the dog can watch out for and learn to kind of anticipate, right? Um, and then after that's pretty reliable, the dog will learn to pick up the heart rate. They'll just naturally learn that. This is the same reason why a lot of service dog trainers won't train a seizure alert dog. It starts off as a response dog, because you're just teaching the dog to respond to the active seizures. And usually, if it's a good dog, they will pick up on whatever is going on before the seizure starts, right? Which we don't even know what that is. So they're picking up on something that is undetectable to us. We taught this little corgi to alert to hair twirling, because that was something that the handler did before she had an episode. So this is me just teaching. Again, we're just teaching the dog to bop my fingers. And here's the finished product here. Yeah, very good. So if you have any questions, please ask in the comments, and thanks for watching.